Next we'll go and discuss regarding system assessment of the neonates. First we are going to discuss gastrointestinal system. Gastrointestinal system you already know. It's from mouth to anus. So mouth we should have to examine regarding abnormalities like cleft lip, cleft palate, or Epstein pearls or brittle white shiny spots near to the hard palate, or any fusion of two hollow palates. That and all we have to check. Next, abdomen cylindrical, it should be in cylindrical shape. Liver should be palpable 2 to 3 centimeter below the costal margin, and spleen, tip of the spleen can be palpable at the end of first week of age. Next, umbilical cord we already discussed. We should have to check for 2 arteries and 1 vein. Next, gum, any irregular edge of teeth or any pseudo eruption, that and all we have to check. Cheeks we have to check for any fat deposition or a chubby appearance due to development of fatty sucking pads. So if fatty sucking pads are developed, it's difficulty to facilitate kids for the sucking reflex. Stomach and intestine. If you are coming to the stomach and intestine, the capacity of stomach varies after birth. During birth, what it will be 30 to 60 ml, but it will increase rapidly. Next, circulatory system. We have to check for any abnormalities of the heart. Respiratory system. We have to check for sternal retraction during inspiration and expiration. And we have to observe for the reflexes present in the respiratory system. And soon after he had delivered, babies are nose breathers. They do not breathe through an open mouth. Urinary system. Normally the newborn voids urine from their bladder after birth or some hours later. And female genitalia and male genitalia, last class we discussed that one. You have to check in detail. Next, endocrine system. During pregnancy, the maternal hormones has crossed the placenta to the baby. After the birth, these are withdraw or cause some abnormal phenomena like swollen breast, infantile menstruation. Swollen breast, it appears in third day in both males and females. It lasts for 2 to 3 weeks. Gradually, it will disappear without any treatment. And also some females have pseudo secretion. That one will call Witt's milk. And infantile menstruation is also called pseudo menstruation. The few spots of blood can appear in the diaper. That one will call infantile menstruation. Next, coming to the nervous system. It's related to the reflexes. Next, reflexes. If you are coming to the reflexes, first, rooting reflex. What is this rooting reflex? When infant cheek is stroked, the infant turn to that side, searching with mouth. Means if your cheek if you are strike on the cheeks of the infant head will be turned to that side and searching towards that finger. That mouth searching with that side. That one we will call rooting. It's finding the root. That is rooting reflex. It appears in the birth and it disappears after 3 months. Next, sucking reflex. Sucking reflex, if you have placed anything in the infant mouth, nipples or finger, it start to suck. That is sucking reflex. It appears in the birth and disappears 2 to 5 months. Next, Morose reflex. Morose reflex, with sudden extension of the head, arms abduct and move upward, and the hands from the form a C. Means the baby body suddenly the baby extend neck and arms are abducted and it start to move upward. You can see in that third picture. What it will happen if any sound or if external stimuli, suddenly baby will extend head. You can see extend head and arms are abducted, means spreaded, and baby start to move upward. That one we will call Morose reflexes, appear in the birth and disappear after 4 months. Next, asymmetric tonic neck. Asymmetric tonic neck means when infants are lying on the spine, one side extremities are extended on the side of the body. So where the one side of the extremity is extended, the head of the child also turn towards that, and another side extremities are flexed. You can see one hand is extended, another hand is flexed, and towards extended hand baby turns. This is asymmetric tonic neck, or this also called fencing position. It appears in the birth and disappears after 4 months. Next, palmar grasp. Palmar grasp, if you touch palm of the baby start grasping that finger. That one will call palmar grasp. It appears in during birth and disappear 4 to 6 months. For example, if you touch the palm of the baby with pen or something, some objective, or with your finger, the baby start to grasp it. That is palmar grasp. Next, plantar grasp. Plantar grasp, infants reflectively grasp with bottom of the foot when you apply pressure on the plantar surface. Means when you apply pressure on the foot of the baby, like plantar surface, the baby start to grasp with the bottom of the foot. You can see in first picture. That appears in the birth and disappears in 9 months. Next, Babinski reflex. Babinski reflex is nothing but if you are stroking along the lateral aspect of the sole and across the plantar surface, resulting in hyperextension of toes. That one we will call Babinski reflex. If you are stroking with your finger on the plantar surface or lateral aspect of the sole, the baby shows hyperextension of toes. That one Babinski. Next, stepping or dancing reflex. Stepping or dancing reflex, when if you are old the baby in the when you are old baby in the upright position or in the standing position, the foot, when one foot is touched on the flat surface, then the baby puts the other foot down as if to step. That one we will call stepping reflex. It appears in the birth and disappears 4 to 8 weeks after birth. Neck brightening reflex. Neck brightening reflex means when baby's body is tilted. You can see the baby body when it's tilted, the neck will keeps in upright position. That is neck brightening position. It appears in 4 to 6 months and persists along with the unit's age. Next, parachute or sideways position. When the baby is sitting position, the baby tilted one arm towards one side as a supportive sitting position. You can see in that picture. It appears in 6 months and it persists as long as next, parachute forward. When you held up in the air, the protective extension with the arms when held up in the air and moved forward to catch something. That one we will call parachute forward. Parachute backward. When the baby body tilted backward, it put arms back and make as supportive position, that is parachute backward. Parachute forward 6 to 7 months and persist along with the neonatal duration, and parachute backward appears in 9 to 10 months. This is regarding reflexes. If you read the description and see that pictures, you will understand.